Good afternoon, everyone. Welcome to today's press conference with Northwood. My name is Tara Wickwire. I'll be your moderator for today. The format is we have about 30 minutes and we will start with some upfront remarks and then move to a Q&A session. So today the intention is to give you an update from Northwood, and so I'm joined by Janet Sim, who is CEO of Northwood, Josie Ryan, who is the Executive Director of Long-Term Care at Northwood, and also Vicki Sullivan, who's the Executive Director of Operations for the Central Zone for the Nova Scotia Health Authority. So once we cover off our initial overview, we'll move to Q&A. And the mechanism for asking questions is if you could go to the Q&A box that's at the bottom of your screen, and if you could put in your name and your outlet and the question that you have, I will then pose those on your behalf. And if you have follow-up questions, you're welcome to submit those as well. So with that, I will turn it over to Janet.
Thank you. Good afternoon, everyone, and thank you for joining us today. I'm Janet Sim, CEO of Northwood. We're here to update you on our current situation at Northwood and the safety measures we have in place to protect our residents against COVID-19. I wish to extend my deepest condolences to the families of those residents who have lost loved ones due to COVID-19 or other complications. Every life lost is one too many, and we grieve the loss of our cherished residents. This has been the most difficult situation any of us at Northwood has ever experienced. Our staff, residents, and their families are challenged as never before. This outbreak is having a mental, physical, and emotional impact on all of us. But every day I'm inspired by the resiliency and courage of our staff and residents. They're giving up, they're not giving up, and neither am I. I want to sincerely thank our hardworking employees. You are our heroes. We are so grateful for your efforts in every day in response to the care of our residents and your commitment to that. We also need to thank our healthcare partners that have stepped up and are lending a hand. The Nova Scotia Health Authority, IWK, Shanex, BON, EHS, and so many others who are supporting us in this response. We truly appreciate the support, whether it's through donations of supplies or increased testing capacity. All of the help is needed and welcomed. This is a public health emergency, something that none of us has seen before. We do not have all the staff that we normally do have on site, and some of the staff who are with us are amazing, but do not know our residents or our routines. We know that while many frontline workers have responded to the COVID-19 crisis across the province, Northwood is new for them. Working at Northwood and in the long-term care environment is a lot different than a hospital setting. Our residents have their personal belongings in their rooms, and to them, we are home. It takes a little getting used to for those who are being called in support from other workplaces. There was a lot of work to do on Sunday and Monday as we welcomed dozens of new team members. It has been tough work, but we've done it. We reached out for help when we needed it, and it came. We're so much stronger now. We are united in the fight against this virus. I have the utmost confidence in the frontline heroes who are working at Northwood, both our Northwood team members who continue to show up for work and our new team members from organizations across the province, most of whom have never been in our facility and some who have never been inside a long-term care facility. We welcome the support from the community, and it's so important that we stay strong and united in order to get through this. When you walk through our doors, you will see determination and focus, not chaos. Everyone has a job to do and is doing it. We received feedback from one of our new team members today that they were afraid to come to work at Northwood because of all the social media, but she came anyway and helped us last night. She said she worked the hardest she had worked in a long time, but she felt safe and supported. Please know that we're so grateful for your help and that we're doing everything we can do to ensure your health and safety. As mentioned last week, we're continuing to provide daily updates on our website. We will continue to update the number of positive cases, recoveries, and those COVID-19 related deaths. We'll do this following the provincial government updates to avoid confusion with reporting. I also want to reassure staff, residents, and the public that Northwood has adequate supplies of PPE to meet our demands. This is an unprecedented demand for those supplies, but we have enough. I also want to remind family members that they can send their questions to northwood@nshealth.ca. For our daily update, we're reporting as follows. We have a total of 228 facility cases. We have 170 resident cases, that's 30 new cases, and 58 total staff cases, which is 1 new case. We do not have any further deaths to report today. We have 3 people in the recovery unit, although we're planning more to move to that recovery unit in the coming days, and we're so pleased with that. And we have many residents on site who are antsy to get back to regular life. In closing, every day seems to bring sobering news at Northwood. There are many residents, however, who are doing very, very well. We have many that are COVID negative, of course. We have many who are COVID positive that are doing well. And there are a growing number of folks who were sick that are coming through this. And we'll see more of those folks moving to a recovery unit. However, it is so hard to reckon with the fact that people in our care are losing their lives. Many of the individuals who live with us are at end of life. End of life care is harsh, sad, heartbreaking, yet beautiful to be a part of that. And that's the work that we do every day at Northwood. Because of the size of our facility, we normally see 10 to 12 heartbreaking deaths per month. The mission of this institution is to bring comfort and peace to those who need it. And in these trying days, we are striving to continue to achieve that. Northwood's hospice team, our nurse practitioner, our medical director, and our new members of the team who have joined us are in this battle supporting individuals who are at end of life. They are not dying alone. The heartbreaking part is, of course, that these individuals are not supported and surrounded by their loved ones at this time. As we have all seen in the past week, Nova Scotians are connected by more than just geography. Simple gestures, a candle on a doorstep, a flag catching the breeze remind us all of what we share. The reaction of staff and residents when Canada Post drove their fleet past our building on Wednesday, honking their horns in a gesture of support was so heartwarming. We really needed that on Wednesday with all of the negative media. It was a tough day for the team of individuals who've been working tirelessly to care for our residents. There is a sense of community here in the air that we've never seen before. While we're all separated, we in a way, however, feel more connected than ever. We all are sharing in pain and confusion in these recent events, but our collective strength and resiliency is keeping us afloat. Let's keep rising above the tide, whether you're on the front lines or thinking of us from home. Thank you and keep it up. Myself and Josie and Vicky are now open to questions.
Thank you, Janet. I'll start with the first question. So this one comes from John McPhee from the Chronicle Herald. His question, the nurses seconded to Northwood have expressed concerns about the lack of PPE. How have you addressed these concerns and exactly what supplies are being provided? Josie, maybe you want to start with that one?
Sure. So we've never had a lack of supplies. Initially, when we had the increase in the number of cases, we had a little bit of difficulty getting it to the floors on time. But whenever anybody asked, it's there. We've had shipments of thousands of gowns, thousands of masks, eye shields, face shields, gloves. So there's no supply, no PPE. We actually have head coverings and foot coverings in addition that infection control is actually saying that we don't really need, but we want to give the staff whatever they want. And when they ask for it, it's here.
Thank you. Josie, I think this is another one that for you. Who is coordinating the emergency response to the outbreak, and describe exactly who is involved, nurses, staff, public health, or others?
So as we started, we have a pandemic plan, which we've had for a number of years. When the outbreak and COVID came into Halifax, it became a team, a pandemic decision-making team that included the CEO, the medical director, myself, a number of people from across the organization, all our managers, our emergency planner, et cetera. So we had all the teams meeting. We met every day at 9:45, and we went through everything that happened. As the pandemic, as the outbreak started to unfold, we then got support from physicians, from Nova Scotia Health Authority. So the Nova Scotia Health Authority, we meet with them twice a day. They have an emergency center going with the Health Authority. We've had people, our physicians, such as Dr. Ken Rockwood, et cetera. So we've been well supported. The MOH, we've been assigned a public health nurse. We've been assigned a MOH for our outbreak, et cetera. So there's numerous people that are taking data and are helping us and supporting us and sending people in whenever we have an ask. We're able to work through it, and we do get the support.
Thank you. So I have a question. This, I believe, would go to Janet. It's from Natasha Pace at CTV. She's asking if military needs to be brought in, the latest number of cases which you addressed, and why are you calling it a public health emergency?
A public health emergency because it's something that we've never seen before, and it requires all of us to respond to this. Calling in the military is not a call that Northwood can make. We do that in collaboration with our team members, but we've not felt that necessary. The response that we've received and the support that we've received from health care professionals across the province has been absolutely amazing. We're feeling so strong today. At this point in time, we know that the military is there if we do need them, but we are so strong and so united today in our fight against this virus.
Okay, thank you. So the next one from Paul Legier, Radio Canada. He's asking, are there any residents who have moved out during the outbreak, either on their own accord or through their family's requests? And how many would that be? And here's a secondary question, just looking for reaction to the NSGEU press release. So Josie, did you want to talk about the number of residents?
Yeah, we've had about, and I can't give you exact numbers because there are people that are requesting to take their loved one homes. We've had about 10 in total. So they left either prior to the outbreak, and we've been working with public health up until last week, and we had another family member that wanted to take their loved one home. We gave them the precautions to take them out in the community because we also have to make sure that the resident is swab negative before they leave, and they have to self-isolate when they leave with their families, and their families would have to self-isolate. So there's about between 8 and 10 right now.
Okay, thank you.
So in response to the NSGEU press release, as I mentioned in my opening remarks, it was a very, very sad day here at Northwood as a result of that, because there are many folks who have been working so hard, so diligent in responding to the needs of our residents. That was very, very disheartening. But we have arisen from that, and I can tell you that, as I previously mentioned, that it was very, very tough work on Sunday and Monday, integrating our dozens and dozens of healthcare professionals who've responded to the call for help and not used to our environment and getting used to us, but we are united now. We've not made any changes as a result of the NSGEU press release. We've been working together all along since Sunday and Monday to learn from one another, to benefit from one another's expertise, but we've not made any changes as a result of the NSGEU press release.
I think I can add to that too with our other unions that do represent our members. So we have NSNU and Unifor, and we have had full support from Unifor and NSNU, and I can't thank them enough. They've put a call out to even have their members come and support us.
Yeah, and this is Vicki, and in terms of the Nova Scotia Health Authority, I think Janet mentioned how difficult the transition was, and it has been a transition, and it's taken us time to work through processes. We're coming into an unfamiliar environment and looking at some different processes, and I think Janet spoke very well to the fact we have work through those and continue to work through those, and our infection control practitioners have been on site and have been helping with making sure that people are familiar with the right PPE to use, how to use it, go through the processes with them, and just reinforcing the good processes that were already in place. So I think we are in a very different spot than we were Monday and Tuesday. I think on Sunday we came together, there was an ask for help, and we immediately responded. And on Sunday evening, we had the first group of staff come in. And it didn't take long, but a couple of days to actually work through the processes, and they've done a great job.
Great, thank you. So the next question we have is from Jean Laroche at CBC, and he's asking, to what extent has this situation been exacerbated by underfunding or understaffing by the province or Ottawa? So Vicki, you've spoken a bit about the staffing, but perhaps you'd like to just open that?
From a staffing perspective, I think we, as individuals know from the media, we moved staff from one of our COVID unit, which was the second COVID unit we had established at the Halifax Infirmary. That was done immediately. In addition to that staff, and that total staffing, along with the support folks, was about 50 individuals, not 50 there every day, but 50 individuals in total. Plus, we have over another 100 staff who have indicated their willingness and support for our colleagues and the residents at Northwood who come. And so we have nurses, LPNs, continuing care assistants, we have physios there, occupational therapists, educators, nurse practitioners, and our physician colleagues, and many others from all areas that are supporting the team at Northwood. This also includes Northwood with some of their communication with families, and I'll go over to Janet or Josie who can speak to some of the work that's gone in terms of contacting families of residents at Northwood.
Certainly, I can speak to that. This is a battle. All of our efforts are focused on fighting a virus that we continue to learn about. With asymptomatic introduction, individuals who have minimal symptoms, it has been a challenge for all of us, and that's what's caught us in our response to this uncertain time that the entire world is engaged in. We have, with the support of the Nova Scotia Health Authority and team members across the province, ramped up our efforts to communicate to families and making sure that people have the information that they need. And individuals who are calling families have resources to be able to reach out if there are questions that cannot be answered in those calls. So we do have teams of individuals who are responding to those inquiries every single day.
Thank you. So the next question we have from Alicia Draus at Global. Can you provide an update on testing? How has everyone now been tested, and what are those tests showing? So Josie, you can probably answer that one.
This week, so in working with the medical officer of health, we've decided to test everybody in the building. We have been testing all along, but we've gone through and swept the whole building. As of this morning, we've done over 450 residents, and we're up to close to 300 staff, and we'll be doing finishing those tests off this week. And that's even people that haven't been in contact. So we're basically doing a broad sweep of all residents and all staff. What we're seeing today, you'll see an increased number in the number of residents, but that's because we've swabbed even the units that have positive cases. So we're re-swabbing even those residents on those floors. So extensive work. We have to put all the numbers together, and we'll have them on Monday, and you'll see every day. We're hoping to see that, well, we know we're going to see some increases, but we're hoping to see that that's going to level off in the next few days. Once we do these swabs, we'll continue to swab if we see symptoms, etc. And we've actually, with moving some people out to the other to our recovery area and moving some people to the COVID area, etc. We're able to free up some rooms. So we've got a number of floors, 7 floors that are unaffected right now.
Great. And she was asking, for those who test negative, how often will they be retested?
So when somebody tested negative, from our experience right now, we're trying to test them every 3 days, or if there's any symptoms at all. So we'll be working with the MOH now that we have everybody tested to see how often they want them tested again, because some people can be negative today and within 48, 72 hours they become positive. So we'll be going back and doing more testing based on their recommendations.
Great, thank you. Okay, I think this next one would be for you as well, probably Josie. It's Stephanie Blanchette from Radio Canada. She's wondering why residents infected at Northwood who passed away weren't transferred to a hospital. And she wants to hear about the cases of seniors in the facility who have recovered.
Okay. So we do have the ability to provide oxygen and to provide interstitial fluids here, which is similar to what they would get in hospital. All of their advanced healthcare directives have been done. And we actually have a team from the NSHA that's helping us with anybody that wants to have more discussion around their advanced healthcare directives. But in long-term care, many residents do have comfort care. So we do provide comfort at end of life. And that's what our mandate is. We have hospice nurses who have done that for many years. We're the first facility that has, and probably the only facility in the province that does have 2 dedicated hospice nurses. That's who we are. We do palliative care, we do it well, and that's why they're not being transferred. If they require transfer, there's a whole medical team that are looking at that, and we have transferred 2 residents to hospital to date. So everyone is being looked at individually.
Thank you. So Janet, this is for you from Jean Laroche at CBC. You seem to suggest the criticism leveled at Northwood by the union representing Nova Scotia health employees came from a lack of understanding of how you run your facility. And can you elaborate on that?
What I can say is when we welcomed dozens of new team members into the Northwood environment, there was some tough work to be able to respond to the unique elements in long-term care. We worked together as a team. We learned from these new individuals coming in, and they learned from us. We were responding to these challenges Sunday into Monday and have continued to respond to those challenges. So it is a team effort here, and we are united against this virus. And that's the message that I want to give, that everything that we've been doing, every issue that we've encountered, very unique as a result of this virus and as a result of the circumstance, we've been responding to, coming together in a united way to make sure that we can resolve all those issues. We want to make sure that people who are coming to work feel safe and feel that they have a good understanding of what it takes to support our residents.
Thank you. So a question from Natasha Pace. So she is asking how many people have taken their loved ones home. I know this came up. Do we have a figure?
Between 8 and 10. I have to talk to, there's a couple this week that are looking to take them home. So I don't know where that's at in the process, but I know initially there were 6 to 8 that had gone before the pandemic came.
Okay. So we have a question from Lindsay Armstrong with All Nova Scotia. So regarding funding, is there any funding from the province that could have prevented the outbreak?
Oh, I'll take that, I guess.
Josie?
I don't think so. We've put everything in place, and we were basically given the ability to bill back to the province for anything that we needed to put into place prior to this. And we have been doing that. So they've supported us in an infrared camera at the door, so it would free up our resources. They've supported us in ordering the PPE that we needed, and if we were running low or we thought we would run low, they've been supplying that as well through the Nova Scotia Health Association. So we haven't had anything, even with licensing, when we've seen some things that are normal practice in licensing, we've been able to alter that if we've needed to, and we've had support all through it. They've supported us through the recovery unit. So we have had that, and like I said, financially, I don't think there's anything that we really asked for that we haven't been able to. We had everything in place that and in place prior to even masking before it became a mandate.
Okay. This is another one from Lindsay, and I think for you, Josie. So as she understands that staff members move throughout the facility as part of regular protocol, is that something that is being halted? Will this protocol be altered?
So given where we were with staffing in the last week, we have had to move staff between floors, but they are all in full PPE. And we have enough PPE to support that. Basically, when you have a contact with someone that's wearing a mask and following PPE, that contact becomes low. So now that we have the ability to transition some people off the floors, and we've done that in 2 floors, we're trying to keep our regular staff on the floors, as many as people that are here, so residents have people that are familiar and know their routines. Some of the things that Janet was talking about around dementia, et cetera. There's many intricacies in long-term care that you don't see in the acute care world, but with the new staff that come in, we're trying to keep them on the same floor so they become familiar too.
Okay.
I'd just like to add for Josie is that we know that our infection control have been very helpful in terms of reminding staff in terms of when they are moving from caring for an individual with COVID versus that in terms of the appropriate practices to follow.
Okay. Thank you, Vicki. So just a point of clarification, this is for you, Janet, coming from Jean Laroche. You said that the facility had 31 new positives, 30 residents, 1 staff. The province has said there are only 23 new positives yesterday. Can you clarify that?
Certainly. Everything is a point in time. We are getting results hourly. We're doing our best to align those numbers, and we are continuing to work on that because we are here and we're working directly with public health and our swabbing results. We do get information on a regular basis, so we need to align and work towards that. So the information is accurate. It's just the point in time issue that we're facing in terms of when numbers are reported versus when we're actually receiving updated test results.
Okay, thanks.
I can add to that. One of the reasons there is because we're testing on site. So as we test on site, we get results all the time. They're always coming in on the fax machine. So 24 hours a day, we're getting testing. So we kind of pick a point at a day to connect with public health, and they report that, but we could still be getting tests coming in at the same time.
Okay, great. And he is also asking, do you know if there are still any residents who have tested positive still in rooms with residents who are not?
I know they're on a couple of the floors right now because what our practice is that if you test positive in a room, a couple of days later we will test the roommate, because you assume that the other person you have to assume that the other person is positive, because if I move them out of that room and move them to a place where there's another negative, they could be positive. So we have to be careful and make sure that we're doing it based on best practice and making sure that they are truly negative before we move them. And if they are, now we have some capacity because of the new unit and because we've moved people back over to the COVID floor, et cetera, to be able to do that. As we're doing on 2 of the floors in the center, anyone that becomes positive, we move them off that floor.
Okay, thank you. This is another one from John McPhee with the Chronicle Herald. Dr. Strang has said large gatherings in March were held, which were attended by staff who were infected but didn't realize that. And that's been pinpointed as the spark of the outbreak, and it quickly spread. Can you confirm this, and what will be done to prevent this kind of thing happening in the future?
I'm thinking that's almost impossible to try and prevent in the future, because we have no control over people gathering outside in the community. Had we known, and had they known, because you have to realize if they were asymptomatic, they didn't even know they were sick. They came in, their temp was checked, we went through the questionnaire, we disinfected their phones, etc. Before the masks, and then the masks came, we put a mask on them, but that happened before the masks went on. So they would have no idea that they were sick at that point. And the symptoms, we've also seen such a significant change in the symptoms, from a headache to feeling tired to. So something most of us feel when we get up in the morning on any given day could be a symptom of COVID. So it's been a challenge, and a challenge for them. I mean, the staff are devastated that it's a source from outside in the community. We're losing we become family. Some residents have lived here 16 years, and it's really tough because they become family and we become their family. So staff are really having a tough time when that comes up, that it could have come in from them. So it's all I can say. It's sad, and it's been a very tough time for staff and for all of us. I've been here 22 years, so many of these residents are like family to me.
Yeah, thank you. Certainly. Well, we are at time. It's 1:30. And that concludes our questions. I will say, I'll reiterate that we will be posting daily updates. So we encourage all of you to visit nwood.ns.ca/information updates. That's very relevant, timely information. So please continue to look for those, and we will plan a more formal update in the coming days. But thank you for your interest and questions today. And thank you for all of our panelists. Appreciate it. Good day. Thank you.